from the beginning of liposuction, there's always been sort of this curve of the more dramatic you go, or the more fat you take, the higher you get a chance of having a problem, having it lumpy or uneven, or having some type of a complication, mainly with the appearance. Now, people have tried over the last 3 decades to try to eliminate that curve and to try to make it to where you can be really dramatic and take a lot more of the fat and be more comprehensive without increasing those problems. Now, with SAFELipo, it allows us to be able to eliminate that curve. And the more dramatic you go, that complication curve never rises. And so I can be really pretty dramatic with removing as much fat as I want, even in pretty thin patients, and we don't ever see those really wavy areas or these increase in cellulite or skin color changes that you see with pretty much all the other forms of liposuction that I've used throughout my career. What it does is allows us to go in and separate all of the fat first. So separating fat from each other, all the little fat globules, and from their connections and from their surrounding attachments. Then we aspirate or take out all of this separated sort of loose smoothie type fat. And then lastly, we go back in and smooth out that entire area. And then it creates kind of a little slurry or a little smooth blanket of these little local fat grafts, and we just leave those in place. As people have gotten more familiar with understanding the concepts of it, they've gotten more comfortable with utilizing this, and now there's just been a lot larger of an uptake by the other plastic surgeons to use this, because I think it just really simplifies things and it just allows us to get better results, which is what it's all about.